Yeah.
All right. Look at Sarah got us connected. Atta girl.
Sorry about that. I don't know what that was, a little technical difficulty glitch or something there.
It was
It's
just testing. It was
I
just
guess
seeing
so.
how your patience was today. All right. For those tuned in wondering what we're doing, we're just testing out technology, but this is the Public Health and Human Services Board meeting for Tuesday, November 17th. And we are doing this virtually. We have determined that an in-person meeting or a meeting conducted under section 13D.02 is not practical or prudent because of the COVID-19 health pandemic and related state and local declarations of emergency declared under chapter 12. The technology we're using allows all members of the body to participate in the meeting wherever their physical location and can hear one another and hear discussion and testimony. It also allows that members of the public present at the regular meeting location of the body can hear all discussion and testimony and all votes of members of the body. All votes will be conducted by a roll call. All right. So first we have the approval of the consent agenda. Would anyone like to make a motion for the consent agenda?
This is Commissioner Mills. I'll move to approve the consent agenda.
Thank you, 009. Can I get a second?
Storley, support.
Thank you, Commissioner Storley. We will do a roll call vote. Commissioner Bersheim?
Aye.
Andrea?
Aye.
Roger?
Aye.
Ginny?
Aye.
Dave?
Aye.
And I am an aye. It passes unanimously. And now we are on for the staff report, and it is Allison Plummer. So just be aware we have a couple Allisons today. Allison, whenever you are ready, I know this is a unique thing for you, but you'll do a wonderful presentation for us.
Thank you. All right, I'm going to go ahead and share my screen here.
Perfect.
All right, so you can see the PowerPoint. All right.
Yep.
Okay, good morning, everyone. So today I'm here to provide you my yearly economic assistance update. So just a general overview of the programs programs and services that we in Public Health and Human Services administer include child care assistance. So everything, as we're used to, really goes by an acronym. So I've included those there for you. But we administer child care assistance, cash assistance for families, which includes two programs. One is the Minnesota Family Investment Program that we refer to as MFIP, and the Diversionary Work Program, which we refer to as DWP. Besides cash assistance for families, we also administer cash assistance for what we call single adults. So there's no dependents in the household. And those programs include general assistance, housing support, which formerly was termed group residential housing or GRH, and Minnesota supplemental assistance. We also have other programs, which include emergency assistance for families and adults that are experiencing a housing crisis. And another big one would be the healthcare programs, which include medical assistance, Medicare savings programs, long-term care services. And then there's also a reimbursement program that is called Healthcare Access. And then SNAP, which is the Supplemental Nutrition Assistance Program. And so really, what does it mean to administer these programs? So that often involves meeting with people in person or over the phone. Well, really in 2020, really just over the phone has been the only option to really discuss someone's household income, any assets, expenses, or other things that could be considered a deduction for programs, and really reviewing that information to determine someone's eligibility and benefit level for these various programs. So the population served by these programs include county residents and residents who are in placement in an out-of-county facility. So that could include supportive housing, treatment, or even foster care. So we provide these services for all ages from birth until death. People with disabilities, people who are employed or maybe unemployed, anywhere from single adults to families. And these programs serve individuals with varying levels of income as well. Each program has different income requirements. So again, you can have services for someone who doesn't have any available resources up to individuals that are still making a fair amount of income and can receive those benefits. All right, so kind of going a little deeper into the trends and just the general caseload update, focusing on 2020. So our caseloads have fluctuated throughout 2020. Some programs have remained steady while others have seen significant increases. So SNAP and our healthcare programs have seen the significant increases or changes since January, while the cash programs, which include both the family and the single adult cash programs, have remained actually fairly steady. And clearly, as we can imagine, the COVID-19 public emergency has had an impact on these caseloads. So first, we'll take a look at the Child Care Assistance Program caseload. So again, this includes families who receive child care assistance through our family cash programs, MFIP and DWP, but also those who are not on any other assistance program and they receive their assistance through the basic sliding fee funded program for child care assistance. So the program eligibility is based on household income, and it provides assistance for childcare costs for working families. And sometimes families do have to pay a portion of care. This isn't meant to cover everything 100%. We have had no wait list for our basic sliding fee funded program since February of 2018. So really what that means is that we do have really automatic funding for people who apply. An update going into 2020. So previously I was the only CCAP caseworker. I have since transferred those responsibilities and my caseload to our financial worker, Ellis Walsh, and she took that over really kind of at the end of January. She went through all of the formal CCAP training with DHS before taking on those extra responsibilities. In 2020, there is kind of a new policy related to child care assistance and processing, and they refer to it as CCAP, expedited childcare for families experiencing homelessness. And that took effect September 21st. And so what that means, it's kind of similar if you think about, we talk about expedited food support, and that's really kind of speeding up the process to determine someone's eligibility for these programs. So with the new CCAP expedited childcare, instead of up to a 30-day processing window, we'd be looking at a 5-day processing window for applications. And this is for anyone who has indicated a homelessness factor or indicator on their application. So maybe they're staying with friends or family, or they're in temporary housing, that they could be potentially eligible for this expedited processing. And so families who apply and meet these criteria could be eligible immediately up to 30 hours per week, up to a 3-month period of childcare. And that's even if they don't necessarily meet all initial eligibility factors. They would just have to meet all eligibility factors at the end of the 3-month period in order to continue receiving those CCAP benefits. So just in general, and looking at our case numbers, and we've had some fairly low case numbers since 2019, but we've been holding steady. We saw a slight decrease towards the beginning of the year, January, February, March, and then started decreasing in May, June, and we've been sitting steady the last several months at about 6 families. And that just is kind of general change, not necessarily COVID specific related. It's just maybe families don't need childcare anymore, especially with more families staying at home, families moving out of the county, etc. So our family cash caseload, again, this is MFIP and DWP. One thing to note with the COVID public emergency, and one of the changes in policy that we've experienced throughout the year is that I think it was starting in April, we no longer determine eligibility for DWP. All families would be determined eligible for, we would determine eligibility only for MFIP. And that's because DWP is really kind of more of a fast paced process for getting people finding employment or increasing work hours. And that obviously became difficult with the start of the pandemic. Let's see here. So I'm just looking at my notes. So family cash programs provide a food and cash benefit. And then they also work with employment services, and that is offered through AEOA. They are our contracted partner to provide those services. And that employment services counselor assists families and caregivers to help really help them look for work or to continue working where they're at and potentially maybe even gain more hours. Those benefits may be issued on an EBT card. We can always vendor pay benefits, etc. So we've had, looking at the chart and the numbers, we've had a similar caseload again with 2019, and the numbers have remained fairly steady, kind of ranging between 16 to 19 cases throughout 2020. So really no significant change or impact that we've seen since the start of the pandemic. SNAP. So again, the Supplemental Nutrition Assistance Program. So we administer this. This is a federal program. So initially our caseload did increase in the first half of 2020. And then we saw a slight dip in our numbers. And then again, we've now seen a slight increase going into fall and winter. So there's some various things that could be contributing to this trend. So there's been a lot of income changes experienced with the pandemic. So initially people saw a decrease in their income if they were impacted by the initial kind of stay-at-home orders and businesses just taking those initial precautions to close down. So people saw that initial decrease in income. So we saw an increase in applications. And then people began receiving their unemployment benefits. And there was the additional $600 per week in federal pandemic unemployment benefits that people began receiving. And there was a little bit of a lull in applying that additional income to someone's active SNAP case. So eventually when we applied that income and began counting it, it actually made many families ineligible for SNAP because they were then over the income limits for the program. So that's why we did see going into like July and August, we saw a dip, about 20 cases or so of less cases that were receiving the benefit. And then as those unemployment benefit have ended, and some people have even exhausted their unemployment funds going into fall and winter, we've started to see again a slight increase in those applications. And looking at the chart, we're actually back to some similar levels in caseload from 2016 and 2018. So interesting that it's kind of an every 2-year trend, it looks like, that we're kind of on par with some of those numbers. So the healthcare programs, again, this includes medical assistance and Medicare savings programs. So we've seen a steady increase in cases since January, and that's similar to case levels back to the fall and winter of 2018. So we've experienced many policy changes and waivers during this public health emergency. This is not only for healthcare, but for really all of the programs that we administer. But healthcare, I would say, it probably has the tightest restrictions when it comes to the policy changes and waivers. And that just means in terms of what a financial worker, what we are able to process and how we can make updates on a case. So really, during this time of the public health emergency, we have to keep enrollees at the same benefit level or better. So if someone has an increase in income, for example, or ages out of medical assistance, they have to retain that same benefit. So instead of, say, transitioning to Minnesota Care or like a private healthcare program, they actually have to remain on medical assistance, even though technically they don't meet quote unquote normal eligibility factors. So again, this has kind of kept those numbers up instead of seeing families or individuals drop off our caseload because they have to retain that benefit. And we can only close cases in 3 specific situations. Either someone voluntarily requests their case to be closed, so they request their coverage to be closed, they move out of state, or they pass away. Other than that, there are no other reasons that really we can make it what we call an adverse change to someone's coverage. So again, paired with the changes in our policy during this public health emergency, the various changes, the waivers, again, we're seeing enrollees maintain their previous coverage. And again, as people are seeing income changes or decreases who are not already on a public health care program like medical assistance, we're seeing them apply. So kind of paired with those 2 instances in those situations, we have seen a significant increase in healthcare cases since the start of the pandemic. So October 2020 snapshot. So just to give you some figures of our current caseloads. So we have 174 people receiving SNAP. I should say these figures are as of October 31st. So 174 people currently receiving SNAP. The average benefit is about $202 per person per month. Now, one thing to keep in mind too is that there have been additional benefits issued through the state, through DHS, as per federal guidance. And so we don't administer some of those programs. And one of those programs is called eSNAP or Emergency SNAP. So what has occurred since the month of April is we determine someone's actual benefit level, and then DHS will go in after each month is complete and issue supplements, which really are the difference between what the person actually received versus the maximum allotment of that they could receive for their household size. So basically everyone on SNAP is really receiving 100% of the maximum benefits that they could get. And so that average benefit per person also takes into account those additional supplements that families are receiving, again, issued through DHS. About 21% of our SNAP recipients have a source of earned income, and about 45% of our recipients receive retirement or some sort of disability income. We have about 15.
Allison?
Yes.
Sorry, this is Commissioner Mills. I had a question about that 100% of benefits
Yes.
based on their family size. What factors would normally make them not receive 100% of the benefits?
It would be based on their income. So the SNAP benefit that families normally receive is determined based off of their income and other applicable deductions like housing expenses, think rent, utilities, maybe they pay for childcare or child support. So all of those pieces of information go into their case file and determine their benefit. So really someone only usually receives a maximum SNAP benefit for their household size if they have no income, because there's no income to reduce that benefit. So with our families that are not already receiving 100% benefit, say they're not working, they don't have a source of income. So our families who are currently on SNAP continue to work and have a source of earned income, how we still calculate the normal benefit, which say instead of, so a household of 1, let's say the maximum benefit, if there's no income, they could receive up to 190 or it might be up to 196. Those values change. Let's say $194 in SNAP benefits. But let's say they have some earned income, which reduces that benefit. It's meant to offset the income that they're making by providing additional food benefits. So let's say their income brings their benefit level down to $100. That's what we determine. They're eligible for $100 in benefits. So this emergency SNAP program, I guess is how you could, or policy, that has was implemented in April, and DHS issues those benefits. That benefit then would be, in this case, we would say $94. They're issuing that additional supplement that would provide that individual up to that 100% benefit.
Thank you very much.
So for our family cash programs, 15 families were receiving assistance through MFIP. And again, I say MFIP because we were not determining eligibility for the DWP program during this time. That includes 13 adults and about 30 children. The average benefit per person was about $311 per month. And about 1/3 of our MFIP participants are working. So that's about like roughly 5 out of our 15 families have had a source of earned income in the last 3 months. And looking at our single adult cash programs, GA, MSA, we had 30 adults, again, without children, receiving that benefit. The average benefit per person on GA or general assistance was about $155 per month. And for those on MSA was about $75, almost $76 per month. And that in general, those two usually are significantly smaller benefits than the family cash programs. So generally, the population that receives cash assistance through GA or MSA, the population is generally unable to work, and most are recipients of or are applying for Social Security disability, or what we call SSI. Now, looking at the healthcare programs, we had 1,005 people eligible for medical assistance. This included 870 people who have their eligibility determined through METS, or more so people know it as MNsure. So we access what people refer to as MNsure. We call it METS. And this is usually eligibility for adults without disabilities under the age of 65, families and children. So out of the 870 people in our METS system, 441 are children. I mean, so that's half of that population of our children receiving that healthcare benefit. So then we also use a different system to determine healthcare benefits for the elderly and disabled population. So 65 or plus, or they have a certified disability. And 135 people have been determined eligible for healthcare through that system, 30 of which are children. And then besides the healthcare benefit of medical assistance, there's also a healthcare program called a Medicare Savings Program, which is to help pay for Medicare Part B premiums. And 94 people were receiving this benefit. So besides those programs that I have referred to, cash assistance, healthcare, food support, we also provide emergency assistance for persons in jeopardy of losing something that is of a basic need. So think heat, electric, or shelter. And the assistance could also be available to resolve lack of shelter or support a cost-effective move. So potentially someone is currently homeless and has located permanent housing, but they need assistance, say, paying for that down deposit first month's rent. Funding is limited. We typically have an average yearly allocation of about $5,000 for what we call our MFIP crisis funds. So this would be crisis funds available for families with children. And then our emergency general assistance fund would be for single adults with no dependents. And that's typically allocated at about $1,000 per year. And that's actually determined by DHS. So looking at our current 2020 payments, surprisingly, even in a pandemic, we've seen less emergency assistance requests this year. So far year to date, we have only spent $225 of our $5,000 in our MFIP crisis funds. We have spent $566.50 in 2020 for emergency general assistance. Again, that is for single adults. So between these two expenditures, that was for assisting 2 households, which comprises of 2 adults and 4 children total, and those expenditures were for past due rent to prevent eviction. So besides our normal or general emergency assistance program, this year we also allocated CARES funds to kind of extend out our funding availability to assist with housing emergencies. And this would be funding available for people who wouldn't meet our normal or standard eligibility requirements for emergency assistance. And so far we have spent about $600 of those allocated CARES funds for housing emergencies for one household.
Allison, could I ask a question on that last slide?
Yes, absolutely.
So I thought I was going to hear you say that we used CARES funds to supplement, well, to basically not tap into the MFIP crisis funds and the emergency general assistance. But it sounds like we didn't really use that much CARES funding. And I'm just wondering, I would think this year of all years would be a year where those funds would be in high demand. And I'm kind of surprised that they weren't more heavily subscribed. Do you know more about that?
Yeah, I have actually been quite surprised too of the so-called lack of emergency assistance applications.
Wow.
There are many other programs though that are also available for applicants, not programs that we administer, that are available for individuals experiencing housing emergencies. And one of the big ones that I believe also uses CARES funds is the COVID Housing Assistance Program. And that's where individuals apply through 211. And then those applications will get filtered down to a local administrator, which is AEOA. So I think some people may be choosing that route. I haven't heard figures on that, but that could be another reason why we have not seen at least more current emergency assistance applications. And I think also the additional unemployment benefits that people were receiving probably really assisted them in not experiencing those emergencies, which we initially figured would occur. And then in looking at the CARES funds that we allocated for kind of extending out our available funding for emergency situations. So yes, we are trying to spend those before we spend any of our kind of normal allocated emergency assistance funds. So the one thing to note with emergency general assistance, so in 2020, we did pay out $566.50. However, emergency general assistance, that kind of funding year runs from July 1st of one year through June 30th of the following year. So right now we are in a new funding period starting July 1st of 2020. So the $566.50 that we spent was prior to having CARES funds and was spent like in February or March of 2020. So that's why we saw that expenditure. Otherwise, yes, we are trying to utilize, once those CARES funds were allocated and approved for spending for emergency housing situations, we definitely would like to try to spend those first. And we have a very short deadline coming up by December 1st.
And did I hear you say that we have $5,000 of the MFIP crisis funds available?
We have spent $225 this year. The MFIP crisis funds actually follows a normal calendar year, January 1st through December 31st. Mm-hmm. So we still have, really close to $5,000 left available. So $4,775 remain in those funds. And
what happens to those funds if they're not used?
We basically, it's like use it or lose it, but we don't necessarily lose the funding. It would just be reallocated towards other MFIP expenditures for our agency. So basically just reutilized in a different capacity, but the funding just gets reset January of next year and would again be reset at that $5,000 limit.
Okay. So do we have other expenses? And I'm sorry to be taking up all this time, but I'm wondering, do we have $4,800 of expenses that these funds could be redirected to then, or are we leaving money on the table?
Yep. So they would most likely be redirected to administration costs. And that's also what occurred last year. We typically find that we have not always spent up to that $5,000 maximum that we have allocated for those crisis funds. So yes, we have been able to redirect those funds to cover other expenses. And again, most of the time that is just related to administration costs.
Okay, thank you.
Yeah, you're welcome. Great questions. So staffing updates. Luckily, we have not seen any staffing changes since last year. We still have 4 full-time workers working with cash, food, and our medical programs. So just kind of a breakdown. We work in what we call a case banking system. So each worker, we have basically one bank of our cases, and then everyone kind of just shares in that workload versus having cases individually assigned to a specific worker. So we have currently 163 cases in what we call our MAXIS system. So that's where we determine eligibility for cash, food, and again, the healthcare programs for individuals that are blind, elderly, or disabled, and our Medicare savings programs. And people can be active on multiple programs at the same time in that system. So out of those 163 cases, we could see someone receiving SNAP and MFIP, or someone could be on MSA and healthcare and a Medicare savings program. So 163 cases doesn't just mean 163 programs. There's 447 cases in the MET system, again, also known as MNsure. So 447 healthcare cases, and that really kind of refers to family units that have healthcare in that system. So that kind of math, if we break down that math, that really is approximately 153 cases per worker, per those 4 workers. And we have now 2 workers that are trained in long-term care. So Agni Smith was previously our sole long-term care worker, LTC worker. Kathy Ann Travis has since completed, or I should say, 95% completed her long-term care training. She is working on her final assessment, but she has been working with Agni and training on processing long-term care cases. And just for our long-term care, or what we call LTC cases, there are currently 59 cases. So besides our 4 full-time eligibility workers, financial workers, we also have our income maintenance case aide position. And that is Sarah Schoonover. She works out in our front desk area. So besides providing general office support, she is also our healthcare access coordinator. And healthcare access is a healthcare reimbursement program for those that of travel related expenses to get to medical appointments. So just in general, looking at program updates, we've experienced many changes due to COVID-19 and the public health emergency. And most of this started kind of around the end of March, beginning of April. So we've seen significant program and policy waivers for all programs. And these changes and these waivers have limited the type of processing that we can do. It's changed the verification requirements. So in some instances, the documentation needed to verify something is different, and sometimes we can take client attestation. And one of the significant things too is how we do interviews and accept applications. Obviously, we're not seeing anyone in person, so we cannot conduct in-person interviews or meet with anyone. So we do interviews over the phone. One of the other previous requirements or normal requirements is that we have to do an in-person cash orientation anytime someone is eligible and approved for MFIP. And that has been waived because we can't meet them in person. Oop, moved ahead. So a lot of those kind of in-person requirements have been waived, and we can even accept an application verbally over the phone. So previously people needed to complete an application, paper application, or they could apply online, and they can still do that. But just knowing that some people may have limitations with technology, they may not have internet access, but hey, they can give us a call and we can run through that whole application with them, and we can actually assist them in filling it out. And basically that then also is an interview at the same time. So really just trying to make the access to these programs easier for people during these times. One of the other things that we have seen is related to our SNAP and cash cases. So beginning back in April, recertifications are required every year to determine someone's ongoing eligibility. Someone is only ever eligible for up to a year's time before they have to kind of go through the whole reapplication process. But in order to continue giving people benefits, to ensure people are still receiving benefits during these times, DHS and also the federal government gave approval to actually postpone recertifications up to 6 months. So what happened back in April through August is all of those recertifications that should have occurred were actually pushed back 6 months. So what's happening now, starting in the month of October, is that we're actually kind of seeing a doubling up of recertifications, because recertifications actually started back up in the month of September. So for example, in the month of October, we not only will process October recertifications, normally scheduled October recertifications, but the financial workers now also have to process April recertifications, because those people still have to go through the process. Their recertification is no longer postponed. So we expect those kind of doubling up of recertifications through the month of February. Healthcare cases, those recertifications as well, those are yearly recertifications, have also been postponed since April, and they are actually continuing to be postponed, and we don't have a time frame as to when those will restart. So people, again, will continue to receive their same healthcare benefits. As I mentioned before, staff no longer see clients in person, so most of our communication is done via phone, email, or even virtually if that is the option available for a client. In terms of being in the office, as we know, most people are working remotely. So staff still rotate being in the office because they have to cover intake duties, and intake duties involve answering phones, screening applications, things like that. So again, between our 4 workers, they rotate being in the office and working at home. And then Sarah, our income maintenance case aide, is in the office pretty much full time. And she does have the ability to work remotely when needed. Just a couple slides left. I wanted to include this, looking at our performance goals for expedited SNAP. So DHS sets specific guidelines and requirements in processing applications, especially when it comes to expedited SNAP. So expedited SNAP is available to units in certain situations. And there's basically 3 situations. So they have less than $150 expected in monthly gross income, and they have less than $100 in liquid assets, cash, checking, savings, etc. And then one of the other big things that we see that is an eligibility factor is units in which their gross income their gross income and assets combined are less than their monthly housing costs and what they expect in utility expenses. So basically they're making less than what they have to pay for their housing costs. And then those people are eligible for expedited processing. Again, that's really getting their application processed and benefits issued within a 5-day time frame. So just kind of looking at our current year-to-date figures, these figures are January up through the month of August. There's always usually like a few month delay for DHS to finalize these numbers. So far we've seen, don't use my cursor. Here we go. 16 total expedited eligible SNAP applications. 13 of them we processed within 24 hours. And then 15 of them, and this is really the guideline that DHS is looking at, is within that 5-day business period. So we processed 15 out of 16. So we're sitting at about 93%. So DHS would like to see, they require that we be at 96% or higher for that 5 business day processing period. But obviously you can see it's harder when you have smaller numbers. We have 15 out of 16 applications. It still puts us at 93%. All right, looking ahead, I thought this was quite applicable. Only if we had a crystal ball will we know. Unfortunately, this year, going into 2021, is going to be very uncertain. We don't know what 2021 will bring. Much of what we do know much of what we do and how we work will be dictated by the length of both the state and federal public health emergencies, as those really drive our current policy changes and waivers that we have to stick to and abide to. Staff will remain busy processing kind of those doubling up in months of recertifications for SNAP and cash going into February. And again, it is unknown when and how healthcare renewals will restart. But we do know that Kathy Ann will continue training in with Agni on those long-term care cases and get more experience under her belt in processing those. And we've also had staff utilizing online and virtual trainings, which previously required travel. So we're really trying to take advantage of any of those current options that we really didn't have before. But other than that, I would like to give a big kudos to the income maintenance staff, the financial workers, our case aide, just everyone in general. There have been a lot of unknowns, a lot of uncertainty, and a lot of changes implemented throughout 2020. And the income maintenance team has done a phenomenal job at keeping up with those changes and really relaying and assisting clients with any questions that they have. So I wanted to give a big shout out to them. And that is it.
Thank you, Allison. Does anyone have questions for Allison?
Yes.
Go ahead.
Yeah, Allison, thank you for your report. It's very helpful. I was talking with someone last week about working on a project when I no longer am a commissioner, which is somewhat personal, and I certainly will reach out to someone in your department, but I do have a general question. The thrift store is thinking about developing sort of an improved Samaritan policy. Would this fall under the bailiwick of your department? I mean, we don't want to create more work, but is there a need for, like clothing, small appliances, that kind of thing, or even maybe some financial assistance with an agency like that? Are there opportunities there, or do you see that, you're providing for those needs from a county perspective or Health and Human Services?
Yeah, Great question. Ooh, it's hard to talk. I've been telling everyone my brain is kind of mush lately. I think we can all agree. So great question. And Allison McIntyre can also provide some input. So in kind of thinking about clothing, household items, things like that, that would be in the realm of public health and human services, but more on the social services side of funding and providing those resources to clients. So our income maintenance team is more limited in the programs that are actually required through the state and federal government, again, SNAP, cash, think food, healthcare. But that is why through social services, they also work with clients and have various funding sources that can actually provide those other types of basic needs. Again, clothing, maybe car repairs. So those would be, so potentially, yes, within our agency, but just what we call kind of the other side of the agency.
Okay, thank you. Well, that's what I was looking for now. And I'll just reach out to Allison, the other Allison, at some time in the future, I'm sure.
Sounds great.
Any other questions for Allison Plummer?
Madam Chair,
Yep.
this is Commissioner Mills, and I just also wanted to thank staff there for all the adapting that's had to happen over this year, and I know there's added stresses there, and I just am extremely grateful for the work that's been done. And as we face 2021 and the uncertainties there, I don't have any doubt about our staff's capabilities and willingness to do excellent work in the upcoming year too. So just really want to send thanks their way.
Thank you, Commissioner Mills. On that note, also, Allison Plummer, thank you for the kudos to your staff, but there's also a big kudos to you and for the work that you're doing. It has been a pleasure working with you for the last 8 years. First in the assessor's office, your positive attitude in that office always shined through, and that attitude in your presentation today and your work with the citizens is very clear. And even though you can't meet with them in person, I am sure that it is very reassuring to someone to get your voice on the other end of the line. I can hear your care. I can hear your love and compassion for people, and you can't train that into someone. So thank you very, very much.
Thank you, Heidi, for those very kind words. I appreciate it.
All right. Moving on to our other Allison. And Allison Plummer, I am sure you have lots to do, so you do not have to stay. You can go carry on your wonderful mission.
Sounds good. Thank you all. Have a wonderful day.
You too. All right, Ms. McIntyre.
Well, I'll just start with echoing the gratitude to Allison Plummer for her presentation. I don't think I could say it any better than you did, Commissioner Dukert. So thank you for that. And thank you again, Allison, and your team. Starting with staff updates this morning, under items for board action, we have a request for approval of the substance use disorder case manager position. Both the position description and requesting approval to post for that vacancy. This position is included in the 2020 budget for Public Health and Human Services. Since January, this position has been filled in a temporary out-of-class position by Sarah Hadley. The position will also include licensing as one of its primary functions. And after someone is hired and trained, the current licensor will shift her duties to include adult mental health caseload in addition to intake, which is her other primary duty. And she will also take on a primary role in the daytime crisis response. So there's kind of a cascading chain of transitions within our children and family services team upon hiring a permanent substance use disorder case manager.
Will this be posted internally first and then public?
It will be, I believe it will be posted publicly and internally at the same time.
Okay.
Any other questions on the substance use disorder case manager position before I move on?
Anyone else have questions on this? No. Allison, do you want us just to approve them as we go? We do have one commissioner that may have to leave the meeting.
Whatever is your preference.
Let's go ahead and do that in case they have to leave. So let's start with item A, approval to post for social worker substance abuse disorder case manager licensor. Roger?
I move it.
Okay, can I get a second?
I'll second.
Thank you, Commissioner Bersheim. So we will do roll call. Andrea?
Aye.
Dave?
Aye.
Ginny?
Aye.
Myron?
Aye.
Roger?
Aye.
And I'm an aye. It's unanimous.
My second staff update corresponds with item for board action letter B, and that is requesting a budget modification for 2021 for the Public Health and Human Services Department for a planned use of fund balance to support maintaining the temporary public health staff hours currently funded through CARES Act dollars into 2021. We are pursuing grant funds to support maintaining staff capacity and do anticipate bringing the acceptance of a grant award to the December Public Health and Human Services Board meeting. This is targeted at supporting the perinatal health educator position. In absence of a grant or other funding source, however, we are proposing to use fund balance in 2021 to maintain capacity. We have recognized savings in 2020 by charging staff time to cares for our permanent public health positions. So we do anticipate adding to the fund balance in 2020 and using some of those realized savings in public health staff time to support those temporary positions through December.
All right, are there any questions? The proposed fund balance amount is $44,909, correct? If we need it. Anyone have questions about that? James?
Yeah, the perinatal grant that you mentioned, Allison, what would the amount of that be?
So we received a award letter, but have yet to receive the grant amount, but we'll receive partial funding through the North Shore Collaborative. I don't know the exact amount offhand. Again, we haven't received the check yet, but anticipate bringing that next month.
Yeah.
And then sorry?
Do you have a ballpark idea?
I want to say $9,000 approximately.
Thank you.
And then we have also applied to the Healthcare Foundation for grant dollars to support that as well, and haven't received the formal notice or check yet, but anticipate bringing those next month.
Great, thank you.
Any
Madam
other
Chair?
questions? Yep, go ahead, Dave.
Thank you. And Allison, I know getting the fund balance up has been a long, hard battle that I support, and so I'm pretty leery of spending that down. But I see the real importance of this position and during the pandemic especially, and just with your explanation, it sounded like there was potential to compensate for that fund balance spending, but I just want to be sure that if there are other options like a second round of CARES funding or whatever, that we can utilize that instead of the fund balance spending. And I don't know if by approving this, if it ties our hands at all in regards to that potential funding, or if it just gives us a safety net in case further federal funding doesn't come through. Do you have any insight into navigating that?
I think what we could do, so it's certainly the intent that we are able to secure other funds to support this need into 2021. And by requesting to use fund balance, this is really a worst case scenario in the event that there isn't an additional stimulus package or funding allocated at the state or federal or local level. And we do anticipate reducing this based on some grant notifications that we have tentatively received. Perhaps, Madam Chair, if you would consider amending the item for board action to state that in absence of other funding sources, we are requesting to use fund balance.
Yep, we have not done a motion yet, so that is fine.
Thank you, and that directly addresses my concerns. Thank you very much.
Dave, we also have the policy that we passed last month that any fund balance uses has to be brought back up to a certain amount. So we are pretty well covered and protected.
Yes, thank you. That's
You're just being careful.
right, and bringing those back up also has an impact. So I'm just trying to, trying to be careful, trying to navigate all the ins and outs of the COVID era.
Yes, it's very interesting. Good thing we got all of those balances back up. All right, are there any other questions on this item before motion? All right, would anyone like to make the motion?
I'll make the motion.
Thank you, Myron. And a second?
Second.
Whoa, all three of you wanted to get in there, but Andrea won the buzzer there. All right,
Madam
with
Chair?
that, yes, sir.
And so this is with that amendment.
Yep, in absence of other
Okay.
sources.
Thank you.
Yep. We will do a roll call. Ginny,
Aye.
Myron,
Aye.
Roger,
Aye.
Andrea,
Aye.
Dave.
Aye.
I am also an aye. Passes unanimously. All right, Allison.
A few more staff updates. One being, you all are aware of this already, but just wanted to share within this board meeting that Jody Turbo Roberts was hired as our permanent public health educator following the resignation of Kristen DeRuta Wharton. Jody is onboarding currently into her new position, so that is impacting as well the conversations that we're having with temporary staff in terms of backfilling Jody's position as she was providing support as one of the CARES Act temporary funded positions. Two of our Minnesota Response volunteers, Joni and Nathan Christensen, have been training on case investigation and contact tracing to add capacity to our local response efforts. We have also identified 2 additional Minnesota Response volunteers to continue to be able to provide the highest quality of case investigation contact tracing locally, as we do see the case volume increasing significantly. Commissioner Dukirk, to your question at the start of the meeting for an update on our current cases, we are at 46 confirmed cases as of our most recent hub update yesterday afternoon. So that's 6 new cases since last Thursday and our last staff update that I have that corresponds with item for board action C. And that is that we are exploring how to use the community health worker model to really strengthen our programming for childbearing families, as well as for people living with substance use disorder. These are both priority needs identified in our community health improvement plan and people whose needs are amplified during the COVID-19 pandemic due to the isolation and lack of social supports experienced by both of those populations. So we are requesting to enter into a consulting agreement with Community Health Worker Solutions to provide technical support to PHHS in exploring the community health worker model, which would allow our department to access revenue through medical assistance in providing supportive services. And this again is a CARES funded very short-term agreement with Community Health Worker Solutions.
Does anyone have questions on this item?
Madam Chair?
Go ahead.
I don't have questions, but I think it's a really excellent proactive approach, and I think it'll pay off big time, and so I'm very supportive of it. So thank you for bringing it forward.
Would you like to make the motion, Commissioner Mills?
Yes, please. So moved.
Can I get a second?
I'll second.
Thank you, Myron. We will do a roll call on this. Roger,
Aye.
Andrea,
Aye.
Ginny,
Aye.
Myron,
Aye.
Dave.
Aye.
Also aye for me. That passes unanimously. Thank you, Allison.
Well, I do have a few agency updates as well. Want to let you all know that this Thursday at noon on WTIP, we will have a panel discussion with Public Health and Human Services staff, as well as Dr. Farshman and Marcia Hyatt, who is a community support line volunteer. The topic of this panel discussion will be on stress during the pandemic. So I encourage you all to tune in or catch that recording. I think it's going to be a great conversation. We'll also have a corresponding article in the News Herald this week on the COVID fatigue and behavioral health impacts of the pandemic. We have also been doing outreach in the area of economic assistance to correspond with Allison's presentation today. She wrote a really nice article for the News Herald last week. If you haven't had a chance to read that, I encourage you to. We are also focusing outreach efforts on social media and doing direct outreach to people who are advised to quarantine by local public health to ensure that they are able to access supportive resources during the time that they're unable to work. We're also working on a new project to record some messages with our eligibility staff in talking about the programs that we administer in PHHS. And the goal is to have a more friendly, direct link to the application process, what that looks like from the perspective of someone who is administering those benefits locally. So we're excited about that as well. We are finalizing CARES reimbursements to local nonprofit and childcare providers. As Allison Plummer mentioned, we did issue emergency aid to one local resident who is experiencing a crisis due to the COVID-19 pandemic. Again, we haven't received the volume of applications that we anticipated, but we are glad that to date we've at least been able to support one household. And we still do have a week before our deadline in issuing direct assistance through CARES. And again, those state allocated funds for families and individuals are available through year end. We have also been notified that AEOA's standard emergency assistance funding is also available. There was some question about that. So very glad to hear that there are several ways for people to receive support if they're experiencing a housing crisis this winter. Our advisory councils are staying very busy and providing valuable input on fostering important connections as well within the community. We'll hear more from the councils in committee reports. Lastly, just want to say that staff are continuing to be quite busy. We're continuing to refine our practices to increase safety, both for staff and for the people we serve in PHHS and in our licensed programs through in-home support and wilderness outpatient. Really want to thank the staff for the time that they are putting in, extra hours, especially within our public health team, as well as our social services staff, staff who are providing support both to our emergency response efforts in addition to their regular duties, really showing up every day, either in the office or at home, navigating constant change, as you heard from Allison this morning, and the stress that we're experiencing both in our work and in our own lives and in our families. And really want to extend that gratitude, again, beyond just our staff, but the partner agencies that we work with, both in healthcare, local service agencies. We often talk about how well we work together, and never has this been more apparent than in the last 8 months. So really grateful for the partnership locally, and as well to the volunteers who are donating their time and skills, both through our response efforts in the community support line, volunteers with the grocery stores, as well as the volunteers that work with us on our advisory councils.
Thank you, Allison.
Everyone, and I'm happy to take any questions on my updates.
Anyone have questions for Allison on the updates? Okay, the only item we have left for board action is the contract for DHS for Children's Mental Health Services. Can you give us information on that, Allison?
Yep, so this is a grant contract in order to accept the grant award from DHS to fund our children's mental health services in Cook County.
Does anyone have questions on this? All right, can I get a motion, please?
Commissioner Mills, I'll move.
Okay, can I get a second?
I'll second.
Thank you, Myron. We will do a roll call. Ginny,
Aye.
Dave,
Aye.
Andrea,
Aye.
Roger,
Aye.
Myron.
Aye.
I'm also an aye, passes unanimously. Thank you so much, and thank you for the update, Allison, and the gratitude again. I love that this is such a hopeful group. So the next is the committee reports, and I'm going to do just a little bit of change because Ginny does have a prior situation that she may have to leave. So I'm going to move item D and H to the top and let Ginny do her updates first. Go ahead, Ginny, on Arrowhead Regional Development Council.
Well, thank you. I'm not going to report on that from last month because there's nothing to report, and we meet this week on Thursday.
Okay.
And then we did meet the Healthcare Planning Committee. We did meet small group. We ended up talking about how can we help support each other more. And I think maybe what Allison mentioned about something coming up will be helpful for a beginning. There's concern out there about our well-being, no matter what position we're in. But I do want to update a couple of things. I will be attending National Association of Minnesota Counties meeting this afternoon, and that will be updating more on mental health federal-wise. And we know that it's down here in our own county too. And then yesterday, the Association of Minnesota Counties, I serve on the Health and Human Services Committee, and we had 11 policies that we looked at yesterday. I want to bring one to our attention. And all of these are policies that will be brought then before our December meeting when we all meet as usual or as unusual because we aren't going to do it in person. The one
Right.
I want to bring to all of our attention is about what AMC supports. And I think it's appropriate for us here to know that AMC supports state and federal policies that authorize additional flexibility and the use of televisits, phone, video, whatever we need for clients, for women, infants, children, WIC program, SNAP program, whatever programming is needed. And that will continue all through the federal ruling, and it will expire 30 days after the federal ruling on our pandemic. So we have a good support there. I'm hoping when I go to AMC annual meeting that that will be one of them that I can support. I know I will support. I hope other people will too. So with that, I have to meet a new refrigerator.
Yeah, that's for the good of the order today. Ginny gets a new refrigerator after waiting months and months and months. So
Have a good and safe Thanksgiving, everyone.
thank you, Ginny. All right, so now we will get back in order and we will go to Arrowhead Economic Opportunity. Commissioner Mills.
Thank you, Madam Chair. We did meet, and it was an annual meeting where recognition is given to AOA staff, and also have some little tidbits of information that I thought was very impressive. Starting in May 28th of 2020, there's been, let's see here, 822,876 pounds of food distributed through AOA to help meet the needs of people who need food in our region. And that would be, let's see, 39 communities, 7 counties, 41,000 people served, 14,000 households. It's a lot of food. Also, there was question just about a little bit about housing and AEOA, and it looks like that Housing Services assisted 3 individuals who were homeless in the past year, and that's just for our county. And then beyond that, there's also AEOA's Energy Assistance Program. And in this past year for Cook County, there were 182 households that received energy assistance. And 81 crisis situations. So there's a lot of need out there, and also a lot of good work being done. And so I just wanted to share some of those numbers. Otherwise, I think there's not more I'd like to report on from that meeting.
Thank you. Arrowhead Health Alliance, that's also you, Commissioner Mills.
Thank you. Did not meet, nothing to report there.
Okay. Arrowhead Regional Corrections, Myron, it looks like the meeting was canceled for this week. Did you meet last month?
Yes, what happened was I gave the report last month about the discussion on the, the bonding money to build meatpacking part.
Okay.
But we did have a special meeting that Friday after that meeting to actually approve that plan. I would just like to clarify, we did delay our next meeting, but we're meeting this Friday.
Okay.
So I think they delayed it a week. When we took action on that Friday, we allocated the funding of over $1 million just for the meatpacking. And just to clarify it, there was previous bonding money, so the total investment in improvements and renovations for the NERC is around $4 million. And there's about 1.3 that's going for the meatpacking, but they're going ahead with that. They were not going to pursue the USDA licensing because they feel they can provide the service appropriately without going through that extra expense of adding some more facility issues that they'd have to have for the retail space. So basically everything's going forward there, and we're meeting again this Friday.
Excellent. Thank you. Community Health Board, Commissioner Mills.
Since our last Public Health and Human Services Board meeting, we did not meet as a whole Community Health Board, but just as the Personnel Committee there. So I guess I don't have anything very big to report.
Okay, thank you. Public Health and Human Service Advisory Council, Roger.
Yes, thanks, Heidi. The notes are in your packet. If you have any questions, please ask, but the notes pretty much handle it.
Any questions for Roger?
Madam
Dave?
Chair?
Yep.
Yeah, well, I think the notes are great, and thank you very much for providing those. That's all.
Welcome. My pleasure. I'll try and keep doing it since I got reelected to chair.
Congratulations.
Excellent. Congratulations. Cook County Local Advisory Council for Children and Adult Mental Health. Andrea.
Well, I don't have any fancy notes to include, so I guess I'm going to step up my game next time. But probably not in all reality. So let's see, we met on November 10th. We received a few updates from Sawtooth Mountain Clinic that the pharmacist is hired and they're still on track for their January opening of the pharmacy. The behavioral health department is continuing to work on their early childhood mental health program, which is working to serve children 0 to 5 years of age. And they're also collaborating on a project that will help to provide support to teachers, specifically at ISD 166, with the hope to reach out to teachers at other schools in the county. The project is in the planning phase to determine what supports would be the most beneficial. Just a few other things. Our PSAs are being played on WTAP and hopefully received positively. And Carly continues her Mindfulness Monday project every other Monday on WTAP. We received a presentation from James at Sawtooth Mountain Clinic about seasonal pattern disorder and ways to help manage those symptoms. And then, and that was pretty much the end of our meeting. We didn't have time really to talk about our mission and vision planning process, but everybody was okay with the process up to where we were at. And then just to sort of piggyback off of Commissioner Mills' AEOA update, there is an AEOA food distribution on Wednesday in Grand Portage and in Grand Marais. So if you, I know that Sawtooth Mountain Clinic and Public Health and Human Services shared the flyers on their Facebook. I'm sure there are other places too, but there is one tomorrow, I guess, in Grand Marais and Grand Portage.
Excellent. Thank you.
Yeah.
North Shore Collaborative, Commissioner Mills.
Yes, we did meet, and it was kind of funny. Before, well, what was it? Just a week before the meeting, there were no applicants for grant opportunities, and so there was a little bit of a push to get some applicants out there. And then, wouldn't you know it, we were flooded, and there was more asks than there was monies. So we had to, be pretty critical going through that. Not per usual, I guess. But as Allison mentioned, there was a grant awarded for Cook County Public Health and Human Services, and that'll be really great, supporting our needs. But otherwise, I guess that's all I had to report there.
Thank you. Emergency preparedness, Myron.
Okay, well, we had a meeting and we had a sort of a round table discussion on some of the concerns of the various agencies that were attending that meeting. And I think Allison McIntyre mentioned something about an article coming out on, the COVID fatigue kind of thing. We discussed some of the frustrations of the various, entities, especially the North Shore Health Hospital and others, that there was at least a sense of complacency, fatigue. Some people thinking that their rights are more important than how their behavior affects others, mask wearing and the political ramifications of that. So hopefully, and it's really been interesting that some of the blaming that can start, in the community where sometimes the agencies are blamed for the problem and they're really a manifestation of the problem in the community. And so hopefully that'll turn around, but we're in a phase where it's affecting everyone in Northeast Minnesota and the Midwest. But really appreciate all the work that staff are doing and these other agencies to hang in there and get that message out. It has been a difficult time, but hopefully we'll turn the corner, at some point. That's basically my recollection. Dave, you, and I think James was there, so they may have something to add.
James or Dave, anything to add? No.
Yeah, I mean, Myron covered it very well, and it was just really informative, the roundtable aspect. I mean, so much of these meetings are currently updates from Grace and what's happening around COVID in our community and our region as well. But it's just really great to get updates from the different partners, whether it be the hospital or the school or the clinic, and just, there's a lot of concern, especially with holidays coming. Just really hoping that we as a community can double down on our practices of social distancing and wearing a mask and washing hands. And I just want to, point out that whereas I'm not going to ask others necessarily to forego seeing their family over the holidays. Just my nuclear family here will not be seeing any extended family, and just hunkering down and enjoying what we have for this holiday season. Trying to do our part in minimizing the spread.
Thank you, Commissioner Mills. And maybe that'll be for the good of the order today, is to just talk about the positive things about not gathering with family for Thanksgiving. That means more turkey per person in your home, because there's a lack of small turkeys this year, was on the news this morning. You don't have to shower, you don't have to brush your teeth, and you don't have to get dressed. So, if anyone else has any other positive things to talk about, oh, James does. Go for it, James.
I saw this morning that Zoom is apparently lifting its 40-minute cap on free Zoom calls on Thanksgiving. So that's an extra opportunity for us all to celebrate the holiday remotely and be able to interact with family members without putting ourselves at risk.
Excellent. Anyone else have positive Thanksgiving ideas for those of us staying at home? All right, Roger.
How could we stay home in a better place?
Right.
Right.
Amen.
Right. So my challenge for next month's public health meeting is someone can come up with the turkey dance. We've all done the chicken dance, so now we're going to have a turkey dance that we'll try and do a turkey dance challenge for next month. Also, anyone else have for the good of the order items? No? Okay, just a reminder, Thursday at noon, Public Health and Human Service update on stress roundtable discussion on WTIP. Sorry, Allison, I kind of butchered that, but you covered it earlier. And John Moran will be doing something Thursday. So Thursday will be a great day for hearing positive things in our community. And with that, we will adjourn until next month. There is no committee of the whole if anyone is tuning in for that. And we will see you all soon. Enjoy your Thanksgiving and embrace the family that you have and love from afar. Have a great day, everyone.
Bye, everyone.
Bye, everyone.